A very good afternoon to all of you. Today's video is going to be for the OET candidates, the nurses and the doctors. First of all, I'd like to really thank you all for helping us in this COVID situation, the whole world. The whole world has realized right now who are the real heroes, the nurses and the doctors. Of course, the cabin crew as well, my colleagues who are still flying, making sure that you reach to your destination. And of course, the soldiers who are protecting us, the farmers, these are the real heroes of the society. And I'm glad that I'm in the training profession for the health professionals right now. My family also belongs from the health profession. So I feel really blessed that I'm able to contribute to your lives through this. So today's video is going to be for the OET candidates. Let's start the video. So, I'm going to be discussing the OET speaking aspects. There are various aspects which need to be taken care of. Today I'm going to be talking about how to speak with the patient. I'll be discussing 4 very important points which will be extremely crucial to get a good score in your OET speaking. So, the first point is relationship building. So now, it's very important that when you start the role play, it's going to be a 5-minute role play, you'll be given 3 minutes to prepare. When you start the role play, it's very important to welcome the or greet the patient in the appropriate way. You cannot be just saying hello, how may I help you? No, we can't do that. We have to introduce ourselves, welcome them, ask them how they're feeling, introduce ourselves, and tell the purpose of this conversation. I'll give an example. Hello, good afternoon. My name is Dr. Albert and I am the psychiatrist here today at this hospital. I understand that there was an appointment that you had booked with me, so we'll be discussing that today. How are you feeling today? So now, you see, when I'm doing that, I'm introducing. First of all, you have to tell who you are. For example, you have to tell, are you a nurse, are you a doctor, are you a physician, or you are a pharmacist? You have to introduce yourself, who you are and what is the purpose. We are giving a proper introduction as to who we are representing, what is the purpose of this meeting, and then what are we going to do about it now, right? So that is very important, to introduce yourself appropriately. So the next point is demonstrating an attentive and respectful attitude. So now, when you introduce yourself, the role play has already begun, right? It is very important that you are listening to what the patient is telling you. It demands it involves a lot of listening skills as well, because speaking is just not about talking, right? It is a bigger thing. The only if you listen to them appropriately will you be able to respond them correctly. So now, for example, if you ask them any sensitive question, try to take their permission before asking them that particular question. To meet the criteria, you should be able to take the permission on to discuss topics that could potentially cause them to feel uncomfortable. If there are any signs that they are not comfortable and they show sensitivity while discussing anything that the patient may find embarrassing or personal. The following is an example. What I would like to do is spend a few minutes with you discussing your symptoms. Is that okay? Please let me know if you're feeling uncomfortable, or please let me know if you're feeling uncomfortable at any time. So now you're specifying what is the purpose of this role play, right? And then you're seeking their permission. You're also giving them an opportunity to stop if they're not feeling very comfortable, right? So very important, demonstrating an attentive and respectful attitude. The third part is demonstrating a non-judgmental approach. So now there might be situations where sometimes the patients might feel embarrassed to share some details, their details with you. So now, for example, if a patient says that they smoke 15 cigarettes a day or they drink regularly, we cannot say, oh, that's a lot, like 15 cigarettes a day? Are you serious? Oh, you shouldn't drink every day. What are you talking? We cannot say like that, right? Our reaction should be appropriate. So we understand that okay, well, you like your drinks, even I like my wines, it's very normal. But I understand that you like smoking. However, the idea is to balance it out a little bit. Slowly we have to reduce it in order to create an environment of healing for you. That kind of behavior. Do not devalue or criticize the patient, when they share their thoughts, or be judgmental about it. Very important. So now you need to maintain a respectful communication. So you should acknowledge the patient's emotions wherever possible. I'll give an example. So what worries you is that the abdominal pain might be caused by cancer. I can understand that you would like to get it checked out. So now when you're saying that you understand that why they would like to get it checked out, you are appreciating, you're understanding that from where they're coming from, where the thought is coming from. That is very important. So demonstrating a non-judgmental approach. Finally, of course, we have to show empathy. See, no one comes to the hospital without any reason. They're of course they're in pain or they're suffering. So it's very but natural that we show empathy towards them. So you should show the patient that why they feel a certain way, and if they're emotional in your interview, you should also say that you completely understand that what they are feeling, and if you had been in their situation, you would have felt the same. For example, I can see that your husband's memory loss has been very difficult for you to cope up with. I imagine I would feel similarly if I would have been in your situation. So by using these terms, you will definitely have a very good impact on the examiner. So make sure that you use these 4 points for your speaking role play. And if you have any questions or comments, please leave in the comment section. I know it's been a while I posted an OET video, but just bear with me. I'm trying to create a balance between all the videos that I make. Take care of yourself and see you soon in the next video. Bye.